To continue our examination of Medicare Part D, we're joined now by Alan Dubow, the Executive Director of Capital Health Solutions. He writes about Medicare for AARP and brings a wealth of knowledge to this topic. Alan, thanks for being with us. Why is this whole thing so confusing for people trying to come up with a plan that fits them?
Well, it's because it's being run by private insurance companies. This is not a government-run program. This is simply something that the government has set up to get private insurance companies in to provide coverage for prescription drugs. That means that there are a lot of companies out there. There's a lot of competition. Each one has their own different plan. They're not all exactly the same. It's a lot of information to deal with. Best way to avoid the confusion is to remember that the first big decision is, do you need the coverage or not? That's the important decision. If you make that decision wrong, that could be a very expensive mistake. When it comes to picking a plan between one plan and another, if you don't pick exactly the right plan, that's a small mistake that will cost you a relatively small amount of money, and you have an opportunity to fix every year.
You can fix it every year.
Right. Every year from November 15th to the end of the year, you have an opportunity to they have an open enrollment period. And during that time, you can enroll in a plan. You can change your plan. So if you pick a plan that isn't working out well for you, either because you didn't make the right choice or because your situation has changed, this is the time when you can fix that by getting into a plan that's better for your needs.
Where do you go for help? And a lot of people do need help on this.
Oh, there are a lot of places to go for help. There's a lot of help available. Best place to start is at Medicare.gov, the government's own website, which actually has a plan finder tool. And what it allows you to do is it allows you to put in the drugs that you take today. And you have to be certain that you know exactly what you take and which dosage size you take. And it will tell you which plans cover that drug and what those plans will cost you and what they cover.
Continuing our exploration of Medicare Part D is David Gross, Manager of Health and Supportive Services for the AARP, and Bill Fralin. He's an elder law attorney who has tried to unravel the confusion of Medicare for his clients. Gentlemen, thanks for being with us today. Bill, let's talk first off about some terms. Means testing.
Means testing, as it applies to Part D, is for individuals who require some form of low-income subsidy, who, because of their resources, because of their assets, don't have the means by which, deemed under Medicaid, to pay for the Part D coverage that otherwise the general population will be paying for.
And how about safety net?
The low-income subsidy is, in fact, the safety net. It ensures that individuals who don't have the means are not forced to pay the co-pays, the deductibles, or if they are paid, they're at a much reduced level. So, and again, it's based on the resources and assets which they have.
David, how does someone know whether or not they're going to qualify really for the safety net?
Well, it's based largely on income and the amount of assets, and it's more generous than state Medicaid programs. The income limits are just under about $15,000 for individual and about $20,000 for couples. And assets are about $11,500, but there's a lot of things that don't count. They don't count your home, they don't count your car, they don't count your personal possessions, your furniture, your jewelry, your life insurance policy. So when you take away all those things, if you've got that amount, you might be eligible. And even if you're not sure, it's good to apply because the value is just so high.
Do you talk about the value? Do you just pay absolutely nothing then if you qualify for this lower income group?
Most people will pay no premium. Some will pay a very reduced premium. You can get drugs for as low as $2 generic, $5 for brand. There's no donut hole, no coverage gap. So it's a very big savings for people.
I know that I have read that about 600,000 people or so that now fit into this low-income category, that they have to re-register?
There are some people who might have to re-register to confirm about whether they still have low enough assets and income. A lot of people will automatically be re-registered in this. The problem is there's still a lot of people out there who are eligible who haven't signed up, and they can still sign up without a penalty. So it's really important for people who think they might be interested to apply, or for people who think they know someone who might be interested to apply, especially if that person is a little too proud, thinking, oh, I don't need this. But this extra help can be really important to them.
David and Bill, let's look now at a sample plan. I think perhaps people can get a better idea of what the benefits are and so forth.
Absolutely. Well, initially, the first part of the plan is you have a $250 deductible, which that initially you pay 100% of that $250 under a given plan.
Unless you're in that low income group. Right?
Unless you're in a low income subsidy plan, then you will pay the initial deductible of $250.
All right.
And then from the $250, for the next $2,000, you'll pay 25% of that, and the plan will pay 75%. So that will be another out of pocket of $500. Then after that amount, that's when you reach what is referred to as the donut hole or the gap in coverage.
That's where you have to pay 100% of the cost of your drugs.
That is correct, and that amount is $2,850, which will be paid out of pocket. Once that money has been paid, then when you reach when that money's been paid and it totals to $5,100, once you've reached that point, then all of your coverage for all your medicals for the rest of the year are covered at 95%, and you have a 5% copay.
Mm-hmm. What about if you wanted to say you'd been getting your drugs from Canada? Can you still do that under this plan?
You can do it, but it's not going to count towards your coverage. The plans don't cover drugs from Canada, so that doesn't count towards your donut hole.
There was a lot of, to wrap this up, a lot of criticism of Plan D a year ago or so. And has it, could it quickly, as you think it's been a success, David?
I think it's been a success. I think people are surprised by that, but a lot of people are finding they're saving a lot of money. There is some disappointment over the donut hole, but I think people are becoming more sophisticated. And hopefully next year they'll know to look at those plans again and choose the one that's right for them.
And Bill?
I think it has been, more people are covered today than were covered prior to the plan. I think it's been a success. It's not perfect, but I think both the public being better educated about it and also the insurance companies being in competition have both come together to create better coverage, which will the trend should continue so that, again, people get better coverage by virtue of Plan D.
All right. Thank you.
Even if you are happy with your Part D plan this year, you should still review your options during the open enrollment period. There are more plans available, and features of your plan may be changing. Before we move on, let's review the typical cost one more time. The average monthly premium for a Part D plan is $24 per month. That comes out to $288 per year. In addition to your premiums, you have deductibles and copays. First, there is a $250 deductible, so you pay 100% of the first $250 worth of prescription drugs you buy. After that, for the next $2,000 worth of drugs you purchased, you pay 25% of the costs, or up to $500. Then you enter what is known as the donut hole. For the next $3,600 worth of drugs you purchase, you are responsible for 100% of the costs. After that, you will only be responsible for 5% of all drug costs for the rest of the year.